Hello, everyone, and welcome to the first ever Team UHN Week of Gratitude. I'm Kyla Kumar, Vice President of Communications and Brand Strategy at UHN. This week is all about recognizing that UHN would not be the #1 healthcare, academic, and research hospital in Canada if it weren't for each and every one of you. So this week, we want to celebrate you and say thank you. Thank you for everything you do every day for our patients and families, for clinical care, research, and education, for our healthcare system, and of course, for each other. Today, and throughout the week, we're bringing you in-depth conversations with UHN leadership about continuing efforts and bold new initiatives we're working on to better serve and support you and our patients, so that as we emerge from the pandemic, we ensure UHN is on the strongest footing possible. And throughout this week of gratitude, we want you to join us in the dialogue. For all of you here in person today at the Mars Collaboration Center, as well as those tuning in on the live stream, if a question comes to mind, please send it in by going to slido.com, type in the event code #GratitudeWeek2023, that's all one word, #GratitudeWeek2023, and enter your question. And that's going to come up a little later in the hour. Now let's dive right in. Today we're kicking off with the week with a State of the Union update. We're talking about the pressing issues facing our healthcare system and how we're addressing those challenges here at UHN. And we'll explore how our bold vision to create a healthier world is reflected in the critical work happening across clinical care, education, and research at UHN. I'm joined by 5 senior leaders, starting to my left. Good morning, Ms. Dr. Kevin Smith, President and CEO of UHN. And if I could ask each of my colleagues to Kevin's left to introduce themselves and their respective roles at UHN. Pam.
Great, thanks Kyla. Hi everyone, Pam Hubley. I'm the Vice President of Health Disciplines and Chief Nursing Executive.
Great, thanks Kyla, and welcome everybody to this outstanding event. I'm Tom Forbes, Surgeon-in-Chief at UHN.
Warm welcome, I'm Brian Hodges, Executive Vice President, Education and UHN's Chief Medical Officer.
Thanks, Kyla, and welcome to everyone. I'm Brad Waters. I'm the Executive Vice President of Science and Research.
Thanks, everyone. So, Kevin, let's start with the big picture with you. Most of us will likely look back on the last 3.5 years as potentially some of the most challenging times of our careers, potentially our personal lives and well-being, and certainly our healthcare system. As we emerge from the pandemic and try to make sense of all that this system has experienced, what reflections might you have that you want to share with Team UHN today?
Yeah, well, first I want to share my gratitude to all the people at UHN did and our many, many partners. When we look back, I think resiliency was defined by the Team UHN response. Just hearkening back, remember, it was scary, right? This was real time. We didn't know anything about this disease. We'd heard some really scary things happening in other parts of the world, most recently in New York, not so far away, prior to that in Europe, and of course Asia. And we were very frightened, I think, by the lack of access or perceived lack of access to some supplies and simple ones, gowns, masks, gloves. But from our procurement team to our clinical teams, right across the organization, people came together. The second piece I think we should be particularly proud of is Team UHN stepped up for those who were dying most from this disease, and those were colleagues and family members and loved ones in long-term care. So you put up your hand and signed up to go out and look after vulnerable people where the disease was most decimating the population. Very, very important, very challenging times. The other piece, and Brad will probably talk about this, was the science, right? So we saw science pivot in real time to asking important questions about COVID, literally in the moment. And last but certainly not least, just the challenges of getting to work. Right? The challenges of public transit, the challenges of anxiety about disease transmission. Members of Team UHN who had vulnerable children, perhaps with longer-term medical illnesses, or frail elderly parents who lived with them. So coming to work, going home, and worrying about all those issues of transition. Yet, throughout every one of those examples, Team UHN was there, as you are every day, for our patients, for our learners, and for curiosity-driven questions that will solve the problems of, at that time, the pandemic, and now as we go back to the more normal challenges of our healthcare system.
Thanks, Kevin. And some people have said that that the pandemic had this magnifying effect of exposing some of the cracks and vulnerabilities that were already there. What gives you hope, though, that UHN can build a future where we emerge stronger?
Yeah, I actually think we did emerge stronger, as challenging as it was, and I don't think anyone wants to go back and have another worldwide pandemic or make us stronger through something quite as challenging as that. But when I look at it to a person, we were united around needs of our patients. We were united around needs of our colleagues and supporting each other. We were united around really putting our shoulder to the wheel with our peers and partners. I think about the kind of thing that the team that went out and did inoculations put to the fore, particularly in long-term care, but well beyond that. The largest inoculation program at Scotiabank Centre. The remarkable learnings we had about vulnerability of marginalized populations. Like every pandemic throughout the history of our world, the most vulnerable people suffer most. So whether they were underhoused or living in poverty or challenged by a number of other population health demographics, that was the population that we recognized and focused on. So again, I think remarkable results. Last but certainly not least, in my career, I've never seen us be so unbureaucratic in healthcare. So all of the walls of bureaucracy fell, and we were making decisions, and I wish we could continue this, in such real time. We, of course, took a minor lens of risk mitigation, but risk was outstripped by need and opportunity. And I'll just also recognize and congratulate many of our political leaders at the time, whether it was the mayor of Toronto or the premier of the province or the prime minister or the deputy prime minister, all of whom reached out to us regularly with one question: what do you need? That there was no political agenda, there was no political infighting. It was focused on what do Canadians need, what do patients need, what does the team need, and how do we build a better system as we come back? And I think that's incumbent upon us for the next generation.
Okay, that's helpful, especially that agility. So let's talk about the future. Frame the vision for us, Kevin. Where do you see the priorities for UHN as we look ahead so that we can continue to better serve our people and our patients?
Yeah, so many of you, I think about 1,000 people already, have had input into the strategic planning process, and I hope many of you today will take the opportunity, if you haven't, to express your view. I don't think it's a radical new direction for University Health Network. It will continue to be the tripartite mission: outstanding clinical care, remarkable health professional education and scientific education, and the pursuit of scholarly research from very basic through applied and onto policy. So I think that'll be very similar. I think the exciting parts of our next plan, our evolutionary plan, one is the application of digital technologies, and really realizing that many of the things that we once thought we have to do in hospitals, we're already demonstrating and proving we don't need to do that. So we have a virtual emergency room that has emerged. 85% of people who are seen in our virtual emerge don't need to come to a physical emerge. We have programs like, I see my colleague, Dr. Stewart, before me, where once it would have been anathema to think we could be doing bone marrow transplantations at home. We're doing that, and it's safe, and it's effective. And so we truly are inventing tomorrow's care today. We think a little bit more about the kinds of important opportunities we learned at UHN, particularly at the Michener Institute, only hospital in the country that has embedded within it a health professional training school, pivoting in real time for, be it a clinician or a non-clinician, to learn about what kind of skills do I need to extend my colleague. And nowhere more than the work that Pam and our nursing colleagues have done. We know we can't educate, can't immigrate, can't figure out a way to generate enough nurses for the future needs of our country or others. So Michener, working with the leaders of nursing, will be a place that really helps us understand how do you use extenders, and how do you use extenders with technology, and how do you actually meet the quality of work life that our colleagues deserve, and that frankly will be necessary to retain people in highly acute environments like these.
Great. Partnerships. Talk to me about partnerships. So we're last year, and Brad, I'm looking at you, Mayo Platform Connect, where people are aware at Team UHN that we're actively in an exploration of a merger with West Park Healthcare Centre. What's our vision for partnerships and how that will contribute to our future?
Yeah, I think the last few years have demonstrated no one's an island. For us to be successful as a truly great healthcare system, we have to have partnerships. I'm going to just gently nudge us to the direction of thinking about how many and how deep. Because, partnerships are wonderful, but they all take bandwidth, and you're all extremely busy. So who are those core partnerships? West Park is clearly a core partnership that I think will lead to an integration. A partnership with places like the University of Toronto and our academic partners, essential to an academic hospital. Partnerships with pre- and post-acute care. When we listen to our patients, and we should daily, what is it that they're frustrated by? They're frustrated by the points of transition of care. Where we often let them down is in the handoff. And, Service A says, well, when you go to the next part of the system, be it home care or long-term care or primary care or rehab care or palliative care, we often don't connect well. And families are left with, who do I talk to? Who's the definitive person that will give me an answer? Is there one number to call? So all of those reasonably simple things that have allowed us, unfortunately, to silo rather than to turn the silos to the horizontal and talk about it shouldn't matter where you are in our UHN system or broader system with our key partners, primary care being at the top of that list. How will we make that wrapping service around the other provider in the care journey as well as around the patient? I think that's going to be what defines good quality of work life, good quality of care, and safe, effective care.
Thanks, Kevin. Okay, I want to come back a little bit later in the conversation, but I also want to bring in some of our other colleagues into this discussion. Maybe Pam, I'll start with you. You hold the portfolio that has potentially, arguably experienced some of the sharpest impact due to the pandemic, the loss of staff in the nursing profession. To those that served patients during the pandemic, what do you want to say to them, Pam?
I think the most important thing is a deep, heartfelt thank you. The importance of sharing gratitude this whole week, but every day for the work that our nurses and our healthcare professionals do. Everybody in the pandemic times leaned in, they contributed what they could with knowledge, with skill, with expertise. They were agile, as Kevin talked about. We really came together as a whole team. So that notion of I'm a professional with something to offer, but I'm a team member, and I'm going to bring my best game to the table. I just want to thank our healthcare professionals and our nurses for fulfilling their social contract, for stepping up to put patients first, to apply their knowledge and skills the best that they could to deliver that direct patient care and also to support their colleagues.
Thanks, Pam. And you've been with UHN about 2 years now. I know you've been out listening and talking to many of our teams. How has that informed our nursing strategy and how we'll be building back capacity within our nursing program?
Thanks, Kyla. Yeah, it's really important to me that I do listen. I actually really enjoy, and I think it's a skill of nursing to be an active and deep listener. So it was really important for me to hear from nurses and build on some work that our people and culture team did prior to my coming. We did, as an organization, do an engagement activity to really hear the voices of nurses, and our nursing strategy built on that. And what we did was we invited many nurses to join conversation, focus groups, contribute via survey, be part of the committee that was overseeing the development of the nursing strategy, because it was really important to me that we have those voices at the table. Because the strategy it's more than a document. The strategy is the voice of nursing. It has, it reflects the many different and diverse roles of nursing across the entire enterprise, and it really is something that is going to guide us forward.
Great, thanks, Pam. So let's talk about a very topical issue. We read a lot about it. We're talking a lot about it at UHN, recruitment and retention of our nursing teams. And I wanted to share a quote that you provided in an interview last year. You said, "As much as we're recruiting and focusing on retaining the talented staff we have, we're likely not going to be able to completely recruit our way out of this staff shortage." So talk to Team UHN a little bit about the other strategies that our team is using to fill the nursing staffing gap.
Sure, thanks. This is a really complex and multi-pronged problem, which is going to require complex and multi-pronged solutions. So there's not one thing that we can do, but on the recruitment side of things, I think our people and culture team, our managers across the enterprise, and many of our nurses have been focused on doing everything they can to share what it's like to be a nurse at UHN, to bring and attract colleagues who come to us through their education route. We've tried to increase the amount of social media profile and presence of nursing and really share some important stories about the impact that nurses have at UHN. And we've also been using some strategies around consolidated recruitment and different strategies that bring new graduates to the table soon. We're also using the New Grad Guarantee, which is funding from the Ministry of Health to extend the orientation of newly hired nurses. So we really want to put that support in place, because not only are we in a crisis of nursing, it really is a crisis of experience. We have many nurses who have left the profession because of their just natural retirement age. We also know that we did have nurses leave the organization and nursing, as a result of their efforts during the pandemic. So while we are seeing a shift in our demographic, we have a younger cohort of staff. I think it's about almost 50% of our staff are under the age of 37. So we know those newly hired staff are from our Gen Z group. They have some new ideas, new opinions, and they want different things. So we're paying attention to them. We're not only supporting them to learn how to be the best nurse possible in a highly specialized work environment, but we're also really trying to pay attention to the work environment, work-life balance, where those opportunities for growth are. We are introducing new ways to support nurses. For example, our emergency department just created a new sort of career line where we're ensuring that newly hired nurses in the emergency department are getting a nursing ED certification program. We've been doing that in partnership with Humber, but we're actually building that into our Michener programming. So that's a really exciting new initiative. We're looking for those growth and development opportunities as part of our strategic plan to support nurses through the Clinical Scholars Program, which is funded through the Ministry of Health. We're also introducing our own nursing mentorship program and a nursing coaching program. Our Peter Monk Center is going to be leading the way on that. And there's so many other opportunities that we're trying to pay attention to celebrate and showcase nursing and our professionals. I think it's one of our important strategies is around advancing and celebrating nursing. So through fellowships, we're going to try to double our CAP fellowships. We are introducing a new award called the DAISY Award, which is an international recognition award for nurses. And we're just really trying to focus on developing our leaders as well so that they can cultivate at the point of care new ways of thinking about nursing work, agile and redefined nursing roles, and really cultivating a healthy work environment. So there's so much more I could say, but I'm like rolling. I'm on a roll here, so I better stop.
No, that's wonderful. Okay, let me bring in Dr. Tom Forbes, Surgeon-in-Chief, into this conversation. Tom, you've been in your role as Surgeon-in-Chief for just over a year now, I think. And another big topic that we hear a lot about in the media is, as a consequence of the pandemic, surgical backlog. So update us on what that looks like for us at UHN right now, and how the team, what strategies are we employing to address that?
Great. Well, thanks, Kyla. So recruitment, retention, backlog, 3 easy files, right, Pam? So, I think as individuals, those people in the room and online, we're different from what we were like post-pandemic and pre-pandemic, right? And backlog certainly has become a buzzword. We have to remember, why we got to where we are with respect to surgical backlog. I mean, we were charged by the province and our country to deal with the sickest patients during COVID, and to continue with our priority programs and to treat those patients who had cancer, who required a transplant, who had osteoarthritis disease, neurological disorders, and cardiovascular disorders that are better treated here than anywhere else in the country. So we were charged to do that, and we need to continue to do that. As a direct result, though, we built up a surgical backlog, and just like recruitment and retention, the strategies are multifaceted, and I'll just list a couple of them. So number one is I really want to thank and call out the administrative staff that are in the individual surgeons' offices, the floors, because as many people may not realize, a lot of these patients require direct contact. So for example, if you were on the wait list prior to the pandemic, your clinical situation may have changed. You may not have required the same therapy that you went on the wait list for, or you may have received it somewhere else. So a lot of these individuals on our wait list required individual touch points by our administrative staff, and that really, we talk about cleaning up the data. It's more just contacting patients individually and finding out where they sit. Secondly is sort of capacity increase, and this was really on the backs of a lot of people, and not just in the operating room and the treatment rooms, but also on the floor. I see some of our floor managers in the audience today. I mean, there was an inordinate amount of work looking at patient streaming and getting patients through the system. We started to treat patients in non-traditional environments, i.e. non-OR environments. We extended the hours both during the day and within the week, to the point that we continue to be one of the few hospitals that have a 6-day-a-week operating schedule for some priority patients that are directly on the wait list. So things like cardiovascular disease, cancer therapy, bariatric surgery, and osteoarthritis. So that's been a main strategy. Where we sit now, though, is as we talk about innovation and defining the future of care delivery, we have to sort of see, where do we sit? Where do we sit in this new reality of backlog, as well as the expectations of a hospital such as us? So this is where we are at this point in our journey.
Okay, thanks, Tom. So let's move from the challenge to the opportunity. Obviously, UHN has this amazing worldwide reputation for surgical innovation. Tomorrow, for people who don't know this, is the 40th anniversary of the world's first successful lung transplant, which of course happened right here at the University Health Network, and that tradition continues today. A few weeks ago, our surgeons performed Canada's first thyroid nodule removal procedure using radio frequency. Talk to us about the vision for this continued innovation in our surgical program.
Sure, and just to highlight the transplant program again, I just want to congratulate Dr. Laura Donahoe and her team, who last week had the first all-female-led lung transplant.
Woo-hoo.
So women rule, right? So innovation can come in a lot of different flavors, and I think we talk about innovations in care delivery, and that speaks to what Kevin's talking about with respect to partnerships, looking at care in other environments. I think that's really important. I hesitate to say this, but maybe we sort of have to thank COVID for some of the unintended consequences and the acceleration around virtual care, because this would not have happened at the speed that it did. Remember, during COVID, we also made the not small decision to continue with the adoption of a new EMR. And it would have been very easy to delay that to now. And imagine if we were now going through that epic adoption as opposed to in the middle of the pandemic. As far as innovation in the surgical sphere, one of the things that many people will be aware of is the further adoption of robotic surgery. And just think of robotic surgery as one example of augmented surgery to make care safer, faster, and better. We talk about computer vision and the adoption of artificial intelligence that Brad and colleagues are leading, as well as augmented robotic tools. So that's where we're going.
So super exciting work. Okay, I have to lean out. Dr. Brian Hodges, Executive Vice President of Education and Chief Medical Officer. Brian, in your role as Chief Medical Officer, tell us about the priorities that you're focused on when it comes to supporting Team UHN.
Absolutely. Like Pam, I want to first express gratitude, not only that we get to work with nursing and the health professions so closely hand in hand, but also for everything that our physicians have done in the pandemic period. All told, including residents, fellows, and staff, there's 4,000 physicians working in UHN's environment, and they're outstanding. I feel very proud to work with them. We do have to think about the changing reality for medical work. A lot of things have changed. They've been alluded to. The nature of work is very different. Not only the adoption of an EMR, which was a learning curve for many physicians, but the adoption and arrival of artificial intelligence. We'll hear later, I'm sure, about the appointment of an AI advisor for us. But for the day-to-day work of physicians, it's become heavier and heavier in terms of the administrative load. And the promise is that we will find AI solutions to try to offload some of that. So that's a real priority to help our physicians grow and learn. I think even though we're very optimistically looking forward post-pandemic, we do have to be honest that it affected people quite deeply. And many of them are still working very intensively in surgery. It's a great example, but not only surgery, the very long hours. Well-being is a major focus. We've appointed a new lead. Dr. Louise Harris is our well-being lead. New quality lead, Lucas Chartier and Pete Wu is our new quality leads. And this leads to professional development for all our physicians to make sure that they're at top of their game for the use of technology, for well-being, looking after themselves and each other. And I would just last say that a real priority for us, I have the great honor of being one of the minor supporters together with Sheila O'Brien and Catherine Wang of UHN Women. And I wanted to share with you that in the last 5 years, of our 70 medical leadership positions, 7-0, we've gone from 15% women to 45% today. So sourcing, supporting, recognizing a diverse new cohort of physician leaders is top of mind for us.
That's fantastic. So Michener, that's just come up a couple times in our conversation this afternoon. Brian, talk to us about the unique relationship of Michener and the benefit it brings to UHN.
Oh, a pleasure. Well, as Kevin said, we are the only hospital in Canada with our own school, one of the few in the world. The Michener integration happened just before the pandemic, and I think there's still lots of folks at UHN that aren't fully aware of its magic and its potential. Of course, it rose to the occasion all through the pandemic, creating all kinds of new healthcare workers, genetics technologists for the struggling labs. You remember when PCR, we used to go every week and do that? Not remembering that. Resident support aides for long-term care, lay vaccinator program. So what they're doing now, under the principal Harvey Weingarten and Fiona Cherryman, Director of Operations, and the whole team, is to innovate completely new professional roles, a new program in digital health and data analytics. New programs in new health professional roles, as Kevin and Pam have spoken about, to try to deal with our shortage of health professions. New programs in nursing, advanced nursing specialties. And very exciting, a new foundations program that will attract people who never would have perhaps gone into healthcare to get a taste of it and then hopefully convert into one of our full-time programs.
Thanks, Brian. Okay, we've talked clinical care, we've talked education. Brad, I'm looking at you. Let's talk research. To be the #1 research hospital in this entire country, one of the top in the world, requires vision and constant innovation. Several weeks ago, we saw the appointment of Dr. Bo Wang, UHN's first chief artificial scientist, artificial intelligence scientist, pardon me. No one
He's
wants to
real,
be that.
for the record.
As far as we know, he's real.
A Canadian hospital first. We also launched the UHN Collaborative Center for AI, another first-of-its-kind initiative in the healthcare landscape. Talk to us about strategy, upcoming research possibilities. What gets you excited to come to work every day at UHN?
Well, thanks, Kyla. And it is always exciting to come to work at UHN, which is a very, very special place. Let me first start also with extending my gratitude and thanks to the extraordinary research environment at UHN that over the past 3 years and during the pandemic has played crucial roles in helping us move through the pandemic and help us think about the future. And one of the really remarkable features or I think learnings that have come from COVID was around the power of the team. As Kevin said, when the pandemic hit, this was a disease no one had, we had never seen before. It was entirely new. We didn't have any COVID researchers. We did have experts in virology and immunology and infectious disease. But if you look back, our entire community came together. We had researchers in the Peter Munk Center, in the Princess Margaret Cancer Center, in Kremble, in rehab, that did pivot and turn their expertise towards solving a new kind of problem. And we also saw groups come across UHN that were united, bringing different strengths, different experiences, different expertise together to help solve problems and raise the ambition of what was possible. And that has really led to a big component of our strategy now, which is the idea of bringing together larger teams across UHN united around a common idea or platform or aspiration in science. And this has been manifested in the creation of new collaborative centers at UHN, and the AI Hub, the Collaborative Center for Artificial Intelligence and Data Science, is one of those. Obviously, AI, as everyone knows, is having impacts already in many areas of health and healthcare. We see commitments to that at the Peter Munk Cardiac Center. For many years, actually, they've been doing that, but also at the Princess Margaret Cancer Center, in Kremble, in Toronto Rehab, in transplant, in virtually every area of where UHN is active, there's interest in AI and data science. And so that's why we've created this new hub, brought this team together. We've announced Bo as our first chief AI scientist. He's someone who himself, I think, reflects that sort of diversity of impact. He works in many different areas, from fundamental biology, drug discovery, all the way to sort of health policy and how AI can be implemented and change models of care. And we're really excited about what the AI Hub can do. It's designed in part to bring our community together, to strengthen what each of us is doing and what our clinical programs and where each of those are headed. But we're also bringing them together to also raise our ambition of what we can do collectively and how we can partner with others. And that includes partnering with other academic medical centers, partnering with the University of Toronto or the Vector Institute, potentially with other tech companies and others interested in the area of artificial intelligence. And we think that UHN is going to have a really important role to play, not only in the creation of new solutions that AI can bring, but also, and perhaps even more importantly, in their implementation. And for us to be really realize the benefits of this and to create impact on patients, it also means getting really good at that implementation side. And it's hard. It'll involve many parts of UHN, our healthcare systems, our ethicists, safety, privacy. Being able to do this well also means being able to do it safely and with high sort of ethical standards. But it's exciting. It not only can replace people or augment skills, but it can actually redesign and reimagine how we deliver health.
Thanks, Brad. So really exciting work. Of course, the one piece that always comes up when we talk about research is funding. Brad, you've been a relentless advocate for stable, predictable funding for medical research, as well as our scientists. My understanding is our scientists spend time looking at grants, upwards of 900 different funding sources, probably more a year. How does this impact our UHN scientists?
Yeah, well, we don't really receive any core funding for research. So every dollar that we spend at UHN on research, and last year we spent $539 million on research, comes from somewhere else. In part it comes, or in large part it comes from our community through philanthropic donations to our two amazing foundations that enable a lot of that research. But it also comes from governments, federal, provincial, international, it comes from industry, and it comes from many other funders of research. And as you said, we had over 900 different groups funding research at UHN last year. And it's tough on our scientists. The funding environment is competitive. We've not seen increases in funding at the federal government over the last 3 years. In a time of inflation and increasing costs, the reality is there isn't enough funding in Canada for research. There needs to be more. We need to have a higher ambition in Canada at the federal level and at the provincial level. But we have obviously a high ambition to do so. And $539 million is an incredible amount to dedicate to research, and we need to acknowledge the incredible support for research that we get. But I see my role also, as an advocate for research and for funding research. I strongly believe that this will be a huge economic payoff for Canada, a huge opportunity for increasing the health of Canadians and the wealth of Canadians and the equity. And the path to do that is through investment, and it should be seen, really as an investment. We do have groups that are struggling at the moment, in particular. When I, said thanks to our community, I should have called out specifically our trainees, our graduate students, our postdoctoral fellows who were here every day in the lab, at the bench, when a lot of people weren't, and it wasn't the same kind of environment that it often is. But they have also suffered, I think, from some of the consequences of underfunding of research in Canada, their stipends, and with the cost of living changes, they need particular attention, and there's been a lot of effort this year at trying to change that, but also raising the ambition for Canada as a whole in this space.
Thanks, Brad. And maybe I'll just open this up because a few of us have read it. Many people who are listening may have seen this. A few weeks ago, or I guess maybe a couple weeks ago, in the Globe and Mail, Dr. David Naylor, UFT president, penned an op-ed, and it was really about this issue of medical research funding in Canada not keeping up with our international peers, and that it's had a cascading effect not just on retaining world-class talent, that's one issue, but on our economy as a whole. Brad, Kevin, others, people want to just weigh in, thoughts on David's assertion, and then solutions. What do we need to do to right the ship?
Would you want me to start? And
Sure.
you can tell the truth. So David Naylor and Stephen Toop, for those of you who didn't see it, penned a very lengthy article in the Globe and Mail, and it was excellent. It was an evidence-based policy brief that really allowed us to think about where have we gone wrong in past governments of every stripe, particularly at the federal level, and how do we right that ship? And I think we have no shortage of looking back and saying, here are some things we could and should, and I hope we'll do better. The challenge, I think, is how do we make that a debate within the broader public? And in the coming years, whether it's 2 years from now in the Ontario context, or whenever the next federal election is called, it would be wonderful to see a grown-up conversation demanded by all Canadians about healthcare, innovation, and the economy. So as I see it, when I listen to people at UHN, what are they most worried about for themselves and their families? They're worried about Canada as a competitive economic force. Can we afford to be a first world country with the best healthcare, the best education, appropriate housing, and the list goes on. The second piece I hear people worrying about is affordability and how will inflationary pressures be met, whether it's the group that Brad's mentioned, our youngest scientists who are struggling on the limited resources that are offered by the granting councils. And then the third piece, I think, is again, how do we not leave groups behind, particularly marginalized groups and groups who are disproportionately likely to suffer. So while I think David and Stephen's piece was a fantastic piece, I think it's not new news to us, and it wasn't new news to them. The challenge is, how will this catch fire with Canadians? And how will Canadians demand of their elected officials and public policy experts that we will narrow this gap?
Thanks, Kevin. Others?
Yeah, I think that Kevin's right. It does require a broader call around the value of the investment here. There's lots of evidence to demonstrate the potential and the value that investments in research have on the economy, on the country, on our future prosperity, and this article did a good job at doing that again, very closely linking the investments in research to our GDP, which is falling in Canada, and the need to sort of have a larger vision for that. But clearly we're not making an effective case because government's not making those investments. Other countries are. And I think we do need to think about how to broaden that message or make that case in a different way that really does link that support for research as an investment for the country and for the future. If you look at the support for the Canadian Institutes of Health Research, CIHR, it's where a lot of our federal funding comes from. The total investment in Canada over the last 20 years is equivalent to the support that the battery plant got announced earlier this year. And clearly the economic case was made for that battery plant, and I commend the government for thinking forward in innovation and making investments that are going to be part of the future. But I would obviously we come from sort of a biased position here, but the potential that research has on future prosperity for Canada is enormous. And I say the word ambition a lot, but that's what I just feel is missing is what Canada could be doing here.
Thanks. Brian?
I just want to add something that contextualizes for UHN. We're the most research-intensive hospital in Canada by far. And yet, Pam will tell you, and I will tell you that for our clinicians in particular, it's harder and harder to sustain an academic career in research. And I think we're working hard to find those pathways for people, whether it's a nurse or a physiotherapist or a physician. But across the country, the data on the pandemic showed that the group that suffered the most in terms of grant capture and the ability to propel their academic work were the clinical scientists. So I think here at home, we have some really important work to do to also sustain that group and help remind the funders, government in particular, that you don't wall off research like it's somehow not connected to the delivery of healthcare. That here, as Kevin said at the beginning, research, education, and clinical are always integrated.
Thanks, Brian. Okay, I have one last question. I'm going to pose it to you, Kevin, and then we'll turn and see if the audience has any questions for us. I've joined, I think I'm about 6 months in at UHN, and from a distance, it's clear that we've worked to expand the scope of what a hospital does. So I'm thinking about things like integrated care, bringing acute, home, community care, primary care together to make those transitions more seamless. You touched on that earlier. We're seeing some really innovative initiatives. There's a lot of interest in our community, the Gattuso Center for Social Medicine, our Parkdale Housing Project. And then I think of things like NORC, our innovation center. You know, how do we support our elderly to age at home with the supports they need? In many ways, it appears that UHN is really taking up the mantle, redefining what a hospital should aspire to be. Can you expand on that, Kevin?
Yeah, well, I think UHN is much more than a hospital, right? So while you'll notice the name hospital isn't in our name, while most of our money gets spent on hospital-based services historically, I think all of us celebrate a day when we think about, does that really need to be here? Or how many patients would put up their hand if you said, I could treat you at home, or you could drive down to downtown Toronto, look for a parking spot, try to get to one of our clinics, sit next to a bunch of people who are pretty sick, or should we think about some new ways of delivering care? And I think it is incumbent on us to really invent tomorrow's care today and implement it. So the invention, the knowledge itself, been around for a long time. I think what UHN has done, thanks to the board's bravery and the government support, is push this to say, what's tomorrow look like? Listening to our patients, we have over 150 very active patient partners. And to a patient, they say, I want UHN to be there for me when I need it, but whenever possible, I'd actually like to see how you could better service me in a convenient way, using technology, using home care visits, using a different approach to care. And what I think this points towards, Kyla, is the consumer influence of healthcare. That increasingly we're hearing loudly, you know, other people experience better consumerism in other sectors than they do in healthcare. And similarly, our providers are telling us, we too are frustrated by the fragmented care we have to deliver. So I think it is, that's one reason. The second reason is Canada's a leader in population health. Since Marc Lalonde, who recently passed away, in around 1970, released The Health of the Population, a document that was fundamentally reverberated around the world in changing our understanding of health and the health of populations. We've talked about it, we've experimented with it, we've discussed it, but we haven't seen delivery organizations implement it. And I think the eureka for this organization, and it's the right one to do it, as Canada's leading academic health science center, was to take the learnings and the promise of population health and turn it into action, whether it was in housing or food insecurity or poverty. Think about our programs. Go across each major program at UHN and identify the 100 most vulnerable people. And do we need to potentially treat those people in slightly different ways? So I think we've recognized that. I think we're now implementing that, and we're recognizing that the disease is not created equal. The disease in and of itself, one can look at, but if you don't look at it in the context of the social conditions, the societal challenges, the family issues, the economic suffering or economic challenge, then we really are treating only the biology. And I think the best healthcare systems in the world know every problem is a biopsychosocial problem. If you'd indulge me, Kyla, I just want to also, in this realm, shout out, I think when it comes to gratitude, a couple of other groups I want to really recognize. One, our amazing foundations, which my colleagues have mentioned. So we're on that top 10 list purely because our foundations raise about $250 million a year. And think about that. That's a huge amount of money investing back into primarily scholarship, education and research, and capital. Wouldn't be possible. It also wouldn't be possible to do it without being a publicly funded institution where no matter who comes to our doors of a top 10 in the world hospital, they get the same level of treatment. If you look at the other 9, that isn't true. Right? They are not in universally funded environments. Paying to play matters in most of those places. For us, we're able to actually treat the patient regardless of their social circumstances. That doesn't mean we've done it perfectly and we don't need to do more work to be aware of those. The second group, you know, we often talk about the remarkable work of our frontline staff, and we should, But the group that sometimes gets forgotten are the meat in the sandwich, the frontline manager, physician manager, scientific manager, who each and every day is getting the squeeze from their staff and the squeeze from the people they report to, be it on budget or access or volumes. And so as we're thinking about gratitude, I want to particularly show our deepest gratitude to people who sometimes take on very thankless frontline management jobs and actually work to solve the biggest challenges in the day. And unfortunately, there's some of the consistent challenges, like flow. We've been talking about flow for my whole career, yet these amazing people keep at it every day so patients can get the care they need. The last group I want to recognize is our board. And you know what, not that many people at UHN get the opportunity to interface with the remarkable governing body that is our board. These are people who, purely as volunteers, come to the hospital, all of whom have had remarkable individual careers working in some of Canada's most creative, sometimes large, sometimes small, organizations. And every board meeting and in between, they bring to us their best thoughts and challenge us to say, in my sector, we're doing this and it's made a big difference. How can you apply it in this sector? Because to a board member, they are all focused on making it better for the patient and the provider and those who support providers. So just want to shout out in
No,
gratitude
thanks,
those
Kevin.
groups.
Actually, before we turn to questions, we've covered a lot of ground here. So I just want to see if any of my other colleagues have anything else that we missed in the conversation that you wanted to highlight. Just give it one more. No? Okay. All right. So they tell me if we've had questions come in via Slido, they're going to appear on the screens in front of us. Oh, there we go. All right. Didn't bring my glasses, but we're going to try this. Dr. Forbes, as an example of innovation in surgery, you mentioned robotics. Can you talk a bit more about this? Aren't the robots created by outside companies, and they're giving the example of the Da Vinci robot, or is UHN developing its own surgical robots?
Oh, great. Thanks, Noah. I think I can see that text, that text well. So yeah, I tried to highlight and I tried to position sort of robotics as one tool that the physician and the team has. So we're talking about augmented care, and robotics being one of them. So depending on where you work in the hospital, you may think of robotics being the Da Vinci or now the Medtronic system, which is sort of intracorporal or tools with respect to a laparoscopic environment. There are others. At Toronto Western, our orthopedic surgeons are leaders in the adoption of computer vision and navigation and robotics. So robotics goes beyond those tools. The other unique opportunity we have is with the Michener Institute. It's already been highlighted, but some of the robotic platforms we have, we're the first clinical site to use these robots, and we become really a go-to place for the education of teams from around the world in North America. So we have a really unique environment as well, and opportunity there as well.
Okay, thanks, Tom. I'm looking here. There's a question around, they're moving for us. How does UHN plan to increase opportunities for growth and promotion for its staff, recognizing these are important pieces for recruitment and retention? I'm going to hand this over, but a little bit of foreshadowing for tomorrow. You will be hearing from Executive Vice President Sheila O'Brien from our People and Culture team, but I don't know if there's any comments that anyone wants to make briefly on that. Pam.
Yeah, I think this is a really important area for us to focus on. Retention of our staff is so important, and we know we need to invest in staff to give them the learning and growth opportunities that they desire, and that keep them stimulated and interested and engaged in the work that we're doing here at UHN. So some of this is going to come through new kinds of programming. I alluded to a few things in the beginning, coaching programs, nursing mentorship programs, leadership programs that our teams are putting on, opportunities for investment through philanthropy and generous donations of many of our of donors. I think we're also going to be able to put on new kinds of programs and expand some of the opportunities. For example, the CAP fellowships that we do have. Last week on Thursday, we had the inaugural Krembil UHN International Nursing Conference supported by the Krembil Foundation. It was a fabulous event. We had over 200 people there, not only UHN individuals who are showcasing their scholarship, but individuals from outside of our organization, and we had excellent keynote speakers. It was a wonderful event to celebrate and showcase commitment of our staff. So I think more of these kinds of events too will be really important to give those opportunities for staff to engage in scholarship and share what they know with the world around us.
Thanks, Pam. Okay, next question. In addition to our work to foster public support for increased government funding, how can UHN play a role in fostering public confidence in science, especially in the face of some of the disinformation we saw during the pandemic? I'm sure many people want to weigh in here on that.
Yeah, it's a great question, and one that a lot of people are talking about and thinking about, and it is extremely important. I think we saw during COVID, and this from a researcher standpoint, it was a time where the entire community, the entire world, paid attention to what was going on in research, and you saw advancements happening, the vaccines, and many of the other developments that happened during that were public news and front headlines in newspapers around the world, and there was a different kind of engagement. But with that also came all of the opportunities for misinformation and for the inclusion of political points of view and so on. So I think it's a good learning lesson, and it does tell us about, even in thinking about pandemic preparedness, we talked a lot about biomanufacturing and scientific capabilities and so on, but there's a really important need also around behavioral science, understanding the issues of communication and misinformation and how to deal with that. And there are opportunities to engage our social scientists in a different way around creating solutions. So just like fundamental science can be a solution for healthcare problems, our research and scholarship in these areas are going to have to be a part of the solution for addressing this important issue as well.
Thanks, Brian.
Time for another shout out. I don't know that everyone knows that UHN has the biggest library system outside of a university in Canada, and they built the Science of COVID portal during the pandemic. The first systematic review they did for free was, does my loss of smell have anything to do with COVID? And they produced one of the first literature reviews showing that. Also, I should shout out about the patient and family education libraries that we have at every site across UHN. So I think concretely to Brad's point, the scientists do the amazing work to do the discovery and to find the truth and the evidence. But we have a big role to play disseminating it among our 20,000 people and all of the 300, 400,000 patients who are here through our important library system and the portal, which has also become a really good source for information.
Thanks, Brian. Kevin.
Yeah, I would just echo, this isn't one anyone will do alone. Right? This is a unified focus, particularly with people who understand communication science and decision-making frameworks and the basic wiring of the brain. So whether it's the American Academy for the Advancement of Science or some of the Canadian institutions, I know I've heard some colleagues talk about until we get Drake and whoever young people like most. I'm not young enough to know who else other than Drake I should be acknowledging, but influencers who make a difference. Yeah, Taylor Swift, exactly. Taylor Swift for sure. And if you have a ticket, Pam wants it. But there's a huge opportunity for us to really try to foster that. And it won't be the traditional science establishment trying to persuade those who question science. It will be public influencers, and we need to play a role in that.
Okay, let's look at our next one. We probably have a couple more. It's encouraging to hear research and innovation is one of UHN's goals pillars. In recent years, it's been difficult for nursing and allied health researchers to obtain PI status. What is UHN's commitment to enabling, promoting nursing and allied health-led research?
Well, there's some good news there, so I'm going to let Pam talk about it.
Okay. This is an excellent question, and this is work that we have to continue to do. So I'm really pleased to be able to share that we have now a new pathway for health clinician scientists in terms of a role description. So this is something that is going to guide and help us determine where we have the opportunity to support an individual who would qualify to be a PI in one of the research institutes and be supported at UHN in an integrated way so that they have both a clinical role to play and a research scholarship role to play. So, we could have a whole session on that. We won't do that right now. But thanks to thanks very much to Brad and to the research executive who definitely rallied around the importance of this opportunity. And now we have to do the hard work of, I think, gaining some philanthropy to support these roles. We also have an amazing Center for Nursing Research at Princess Margaret, and there's been investment there through the chair of nursing, one of the chair of nurses in oncology, and through some philanthropy that supported the development of a center. So that has built out the pathway for research, and we're capitalizing on the amazing research that is coming from that group as well. So there's a lot of opportunities to come, and we do need to push the envelope on this, and we do need to do things differently, because this is part of one of the, I think, integrated and redesigned career pathways that is so important both to attract and retain talented health professionals and nurses at UHN.
Thanks, Pam. Okay, I'm going to take one last question here. Given our local to international role as an academic health science partner, can we hear more from Brian and Pam about the future of teaching and learning at UHN?
Shall we battle it
Yeah,
out?
go
Okay.
for it. Go for it.
All right, I'll start and then you can add. Again, an excellent question. I think, we are an academic health sciences center. We are a learning system. So we have to continue to find ways to build learning opportunities into the daily activities for our staff. And this is one of the work redesign activities I think is so important for retention. In addition to that, we know that we are really here to create the next generation of providers across all of our health disciplines. So I think we have opportunities to fully embrace our roles as teachers. And I know I've challenged recently our colleagues, particularly in nursing, to double the number of students that we take at UHN. I'll just let you think about that a bit. That will be challenging, but it is so important because we have so much to offer. We have expertise we need to share so that we can build out the next generation of health professionals. Brian, you probably have something more to say.
Just very quickly to say we have a ton of resources for people that are interested in a career in education. We're all in education, we're all teaching, and we're all learning all the time. Whether it's the Center for Advancing Collaborative Healthcare Education, the Wilson Center, the Institute for Education Research, anyone interested in this area and developing it as a career path, we're here to help support that.
Thanks, Brian. And last word, Kevin, anything else you want to add?
Well, I think that my colleagues have said it well. It is finding the unique balance of that tripartite stool, I guess. Education at a time when we know it's very demanding in terms of clinical care. Research at a time when funding and clinical demand is pushing researchers more and more to the clinical side, and of course, clinical excellence. So I think in these coming years, it'll be more important than ever that we really step back and say, have we struck the balance correctly? And how will we do that, and what resources are required in order to preserve and protect areas particularly beyond our clinical mission?
Okay, great. Thanks, Kevin. All right, we've come to the end of our time today, the first installment of Team UHN Week of Gratitude, a week where we celebrate you and say thank you. UHN would not be UHN without all of you. I want to thank all my colleagues for sharing a wealth of insights today. Thank you everyone in the audience for being here. Today's live stream will be posted on our UHN YouTube page. Coming up tomorrow, it's all about investing in Team UHN. Join us in person at the Toronto Rehab University Centre Theatre or via live stream, and you can check your email for the live stream link. That's happening Tuesday, November 7th, starting at noon. If you'd like to submit a question for tomorrow's panel, go to slido.com and enter hashtag GratitudeWeek 2023. And if you want to know more about the Team UHN Week of Gratitude, go to the UHN SharePoint page, click on Team UHN Central. That's our new space to discover organization-wide information events. And near the top of that page, you'll see the Week of Gratitude logo. Select that. You'll find information about all the week's festivities, including details on treats and prize giveaways this Friday, November 10th at the Princess Margaret Hospital, and the opportunity to win Leafs and Raptors tickets. To enter, all you have to do is protect yourself from the flu. If you get the vaccine on site at UHN, or if you've already done that, know you're automatically entered. And if you get your shot off-site, send in your proof of vaccination to UHN Health Services. The deadline for entry is tomorrow, Tuesday, November 7th, and the Leafs and Raptors ticket winners will be announced this Thursday, November 9th, during our Foundation Power Hour broadcast at noon. I want to echo Kevin's thanks. A huge thank you to the generosity of both the UHN and Princess Margaret Cancer Foundation for all this week's prizes. Okay, thanks everyone for tuning in. We look forward to connecting with you tomorrow. Have a great afternoon.